Hello friends, so today we will discuss very important topic antimicrobial drug. So the various learning objective in this session include we will discuss antibiotic, we will classify antimicrobial agent, and we will differentiate between broad spectrum and narrow spectrum antibiotic. And we will also discuss mechanism of action behind the different antimicrobial agent. So let's come to introduction. Antimicrobial drug mean those drug which kill or inhibit the growth of microbe. So what is microbe? Those agent which causes disease or infection. Mean those agent which causes disease or infection in human or other animal. So it may be bacteria, virus, fungus or parasite. But here we mainly target bacteria. That is antibiotic. So antibiotic medication are drugs that kill or inhibit the growth of bacteria. Mean those drugs that kill or simply inhibit bacteria from growing or inhibit the multiplication or division of bacteria. This is known as antibiotic. Then antibiotic is classified into different categories on the basis of spectrum, on the basis of type of action, and on the basis of mechanism of action. So let's come to first classification on the basis of spectrum. So broad spectrum and narrow spectrum. Broad spectrum antibiotic that is effective against a wide variety of organism. Mean those antibiotic which kill both gram positive and gram negative bacteria. For example, tetracycline. So, broad spectrum antibiotic target wide variety of organism, but choosing a broad spectrum is not always the best course of action. Yes, if a patient has an infection that is likely life-threatening situation, and you don't have time to find out specific bacteria or microbe, then doctor prescribe broad spectrum antibiotic. Otherwise, there is drawback. Choosing broad spectrum antibiotic for mild infection or without prescription because it target wide variety of organism. So it not only kill bad bacteria or bacteria that cause infection, it also kill good bacteria that is normal flora. So that's why sometimes taking a broad spectrum antibiotic, you can get some side effect after taking broad spectrum antibiotic. So one of the side effect gastrointestinal tract disturbance, GIT tract disturbance. For example, stomach ache, diarrhea, and constipation. That's why using a broad spectrum antibiotic with a lot of precaution. Now let's come to narrow spectrum antibiotic. So antibiotic that is effective against only specific type of organism. Mean those drugs are antibiotic which effective against specific type of bacteria, especially gram-positive bacteria. For example, penicillin and erythromycin. A target peptidoglycan of bacteria and effective against gram-positive bacteria. So remember that gram-positive bacteria have much thicker layer of peptidoglycan, and gram-negative bacteria with thinner layer of peptidoglycan. If you inhibit peptidoglycan, then this drug is more effective against gram-positive bacteria and less effective against gram-negative bacteria. Another example of narrow spectrum there is clindamycin. Clindamycin is very narrow spectrum. It only kills specific type of bacteria. It effective against Staphylococcus and use for skin acne. Now let's compare some bacteria in their spectrum. Let's suppose we have mycobacteria, mycobacteria that causes tuberculosis in human, and gram-positive bacteria, gram-negative bacteria, and calmareous. Now, several composition of gram mycobacteria is very unique. It is made up of glycolic acid. Now, if we treat tuberculosis, we require bacteria isoniazid. It kill mycobacteria. So mycobacteria is kill only isoniazid. So isoniazid is neurospectrum antibiotic because it kills specific type of bacteria, that is mycobacteria. Now, if we talk about penicillin, so penicillin kill all gram positive and some gram negative. So penicillin kill all gram positive bacteria and some gram negative bacteria. As compared to penicillin, isoniazid is very narrow spectrum because it kill only one type of bacteria, and penicillin G kill all gram positive bacteria and some gram negative bacteria. Now come to tetracycline. So tetracycline is very broad spectrum antibiotic because it kill gram positive, gram negative, and some fungus. Tetracycline. So tetracycline is very broad spectrum because it kills gram positive bacteria, gram negative, and some calmareous or fungus. So tetracycline is very broad spectrum antibiotic, and isoniazid is very narrow spectrum antibiotic. So that's all about broad spectrum and narrow spectrum antibiotic. Now come to another classification on the basis of type of action. First, bactericidal, mean antibiotic which kill bacteria. For example, vancomycin in penicillin. Actually, cidal mean kill. So it directly kill bacteria. Those antibiotic which directly kill bacteria, this is known as bactericidal. And bacteriostatic. Static mean same. So antibiotic which inhibit the growth of bacteria. Mean those drugs which simply inhibit bacteria from growing, from multiplication and division. So example of this group tetracycline and trimethoprim. Now, choosing broad spectrum antibiotics sometimes more beneficial as compared to bactericidal. For example, if you have a large number of gram-negative bacteria and you chose bactericidal drug, you know that cell wall of gram-negative bacteria is made up of peptido lipo lipid bilayer lipidase. Now, if you choose bactericidal and you have a large number of gram-negative bacteria, then all bacteria rupture and release lipidase that goes under toxin and may cause stroke. That's why sometimes bacteriostatic is best as compared to bactericidal. Now come to another classification of antibiotic on the basis of mechanism of action. So some bacteria inhibit cell wall synthesis like penicillin and cephalosporin, and some bacteria that inhibit protein synthesis like tetracycline and aminoglycoside. And some bacteria disturb nucleic acid synthesis like quinoline and ribampin. And some cause leakage of cell membrane like polymyxin. So we will discuss every classification and detail in the next slide.